I'm Dr. Sundari Mace, Sonoma County's Public Health Officer, and I'm here to share the latest updates on coronavirus in Sonoma County. As of today, we have 142 cases of COVID, 5 new cases since yesterday. 89 are active, 52 have recovered. We still have 1 death, and now we performed 3,251 tests. What's new today? Well, I have issued blanket orders today for individuals who test positive for COVID-19 to isolate themselves. I've also issued another order that requires people in the same household and all close contacts of the person with COVID to quarantine themselves. So what do these orders really mean? Well, the isolation order is specific for people who have been diagnosed with or are likely to have COVID-19. And it says that they must immediately isolate themselves in their home or another residence. They cannot leave their place of isolation or enter any other public or private place except to receive medical care if necessary. The quarantine order speaks to all of the contacts of the person who has COVID. All household members, intimate partners, caregivers of the person with COVID, and all of those that are notified by disease control as being a contact to the person with COVID must quarantine themselves. How is this different than what we were doing before? Well, before, the orders were issued requiring people to isolate and quarantine on a case-by-case basis. So now these new blanket orders replace those individual orders and apply to every single person diagnosed with COVID and all of their contacts in Sonoma County. So with these blanket orders in place, it's be much easier for healthcare providers to issue standardized isolation and quarantine instructions to anyone who's diagnosed with COVID, suspected of having COVID, and to all of their close contacts. Why are we doing this? Well, isolation is a critical way for us to reduce the spread of COVID-19 by getting people who are sick out of community and isolated at their residence or another residence. Quarantine separates and restricts movements of people who were exposed to a contagious disease and to follow them closely, as we have said we're doing, to see if they become sick over time. Now, the blanket orders for quarantine and isolation are critical tools for supporting public health disease control containment work here in Sonoma County, especially as we're having more and more positive COVID-19 cases. They'll remain in effect until we decide to lift them. So what's our question from the community today? Well, we actually have 2. The first question is, what is Sonoma County doing to prepare for aggressive contact tracing? And we discussed this yesterday already. We already said that we are following all contacts to known cases aggressively, calling them on a regular basis to see if they develop symptoms, and that we're testing both symptomatic and asymptomatic contacts. That again is the reason why we have diagnosed so many more cases this week. The other question is, when will rapid testing be available? We're working on rapid testing platforms. In fact, we've been notified by Cepheid, that is the company that makes a test called GeneXpert, that we'll be receiving 10 kits of 12 tests each very shortly so that we can begin our very rapid testing. Thanks very much for joining, and I will see you next week.